Hello, I'm Dan Leonard, President of the National Pharmaceutical Council. Recently, the healthcare reform bill that was passed by Congress and signed into law by the President includes a new institute of the government, a quasi-public and private center known as the Patient-Centered Outcomes Research Institute, or PCORI. The primary mission of the PCORI is to spearhead and oversee comparative effectiveness research. Research that can be used by providers, by patients, by all stakeholders in the healthcare equation to look at different courses of treatment to understand which ones work best. That is the theory behind the PCORI, and the establishment of this institute will be getting underway shortly. Joining me today is Dr. Bobby Dubois, this Chief Medical Officer of Cerner LifeSciences. Welcome, Bobby.
Happy to be here.
And Dr. Dubois has just completed a project with us, which we call Demystifying Comparative Effectiveness Research. And the timing is really quite good with the establishment of this new center, Bobby, to look into what makes good research, what are the things that individuals should be looking for in comparative effectiveness research, and that's what this publication goes into. Do you mind just giving us a taste of what you have in the publication?
Absolutely. So there's likely to be a large quantity of research that leads to a series of reports over the next number of years. So there may be 100, 200, 300 studies comparing one way to manage a patient versus another. And these reports will come out, they'll be widely available on the web, and then people will then ask the question, does it apply to me? Should it be something that is a part of policy making in a health plan? I'm a physician, I manage many patients, each one that comes to me with some of these reports. How can I quickly digest the information and determine whether it's applicable for me, for my patients, or for my group of health plan members?
Let's give the viewers just the scope that we're talking about, the amount of comparative effectiveness research that has been done historically in this country over the last few years versus where we're going with this new government investment in CER.
I don't know that anybody's quantified it as well as I might like, but I would say that we're probably going to increase funding by about tenfold. In the stimulus bill, there's about $1 billion that is going towards this. Every year, moving forward, there will be about $500 million, which is probably 10 times what's currently being spent on this type of effort.
So significant
Absolutely.
new investment.
Absolutely.
And so this report helps people understand what to look for specifically in those research studies when they come out.
Exactly. So that rather than having to read it from page 1 to page 100 and all the appendices, we basically came up with a pretty simple how-to guide to look at these reports, basically divided into 3 different sections or questions. The first is, and most importantly, does the report apply to me or the group of patients that I'm interested in? For example, I have rheumatoid arthritis, but if the study looked at people with severe disease and I have mild disease, the report may not apply to me. So that's the first question. The second question is, how did they do the study, and did they do it with a proper methodology? And we help you walk through to determine that. And then lastly, this is not written in stone. Science is moving very rapidly, and perhaps this report won't be applicable a year from now or 2 years from now, so we should be cautious about how rigorous one takes these results and turns them into policies. So in the report, we have both how to do this, but then we have case studies, so you can read through them and learn how to apply the principles, and then a series of checklists, much like an airline pilot when they're getting ready to take off. As you read the report, there's a series of checklists that you can say, oh, this works for me, or you know what, this may not be applicable.
In addition to the specific questions that you just framed, there are 3 different types of research that you do these case studies on: randomized controlled trials, meta-analysis, and observational studies. Can you describe the difference and why it was important to look at those 3?
Right. A randomized trial is a very rigorous, controlled experiment where you have 2 groups of folks. One get one type of therapy, one might get another, and then you very carefully analyze and see whether one therapy was better than another. It's very controlled, so it tells us, can the therapy work? It doesn't tell us in real life if it's going to work. The next type of study, which is observational studies, is looking at real-world patients who went to their doctor. They may have gotten therapy A, or they may have gotten a different therapy, and we're looking to see were there differences in how often they ended up in the hospital, or the amount of money they spent for the year, whether they had a heart attack or stroke. So that's a real-world study. A meta-analysis, which is the third type, is where you basically take what's been published and lump it together into one giant statement. So you might have 5 studies, some were big, some were small, some showed a real strong effect, some didn't, and with meta-analysis you bring those studies together and get a much stronger answer because it's really the power of all 5 studies done together. The challenge, of course, is one size doesn't fit all. One study may be best configured for one question, another study for a different question, and each one of these study designs has their own limitations that you have to be aware of when you're doing the study and when you're analyzing to see if it's applicable.
Well, so they each have very deliberate or very definite strengths and weaknesses, each type of study.
Correct.
Important for the investigator at the front end to know this, of course.
Correct.
But for the end user, many of whom will be lay people, providers, patient advocates, it's really important for them to know the strengths and weaknesses as well, correct?
That's correct. And the average folk reading these are not going to be scientists or methodologists. So they're going to have a harder time determining whether the study was designed perfectly or analyzed correctly, which is why we place the greatest emphasis on the first question, which is it doesn't really matter whether it's a good study or a bad study if it doesn't really apply to you, meaning it was a different type of patient population, or this was done in a rural environment with different type of care opportunities. If it doesn't apply, then you don't have to worry about the methods. On the other hand, if it does apply to you or to your patient group, then digging into the methods is more relevant.
You mentioned earlier, you mentioned checklists, and that's one of the features of the executive summary report, are the checklists that people can go through for these types of studies. Why don't you spend a minute on the importance or value of these checklists? Right.
It's one thing to say, okay, I should determine if it's applicable to me, but how do I know? What are the questions I need to ask to even answer that? So we have about 7 questions pertaining to that. So what type of patients did they do? What were the endpoints they looked at? So maybe they only looked at whether people ended up in the hospital, but frankly for me or my patients, it's really about quality of life. Could they return to work? Maybe they didn't measure that, so that's very important. Maybe they only looked at the population of folks for a year. And frankly, the disease I have is maybe something that's going to last 5 or 10 or 15 years. That may not be a long enough time frame. So for each of the general areas, we've given you a series of yes/no questions. In general, yes is good if they did that. And it will allow you to delve in to determine whether this is, works for me or does not.
And the final question, as we get into the time where the PCOR, the new Institute on Comparative Effectiveness Research, is being built, put together, and a lot of unknowns around that and questions that remain. Do you think research like this, is important? Is there additional research in this vein that you think would be helpful going forward?
Well, one aspect of the research is to say, I really would like to know what is the best approach to diagnosing a patient or managing a patient. The next is, how do you get people to actually follow it? How do you get patients to be motivated to do the right thing, physicians to do the right thing, and your health insurance plan to pay for those things? So that is a whole nother area of research that both the government will be doing and a variety of other groups as well.
The translation into practice.
Exactly.
And that is a very important next step.
Exactly.
Well, thank you for joining us today, Dr.
It's been my pleasure.
Dubois, and it's been a pleasure working with you on this project as well at Cerner.
Thank you.
And if you would like a copy of Demystifying Comparative Effectiveness Research, a case study learning guide, or the checklists that we were just talking about, you can download those, or they're available for you at www.npcnow.org. Thanks for watching.